6.
Again. Where's the breathing?
In Arkansas, 1 in 3 people receive Medicaid coverage. Medicaid helps to pay for medically necessary medical services for individuals and families in households with low incomes. There are various Medicaid programs that provide access to medical care for families, such as AR Kids A and B, traditional Medicaid, dental coverage, past services for those with severe behavioral and/or mental health services, TEFRA, and the AR Home Medicaid Expansion Program. The purpose of Medicaid, the Lived Experience Project, is to engage Medicaid populations, such as applicants, enrollees, community partners and organizations, and providers, with sharing their experiences with the Arkansas Medicaid program. To understand the successes, opportunities, and areas of improvements within the program. During the past 2 years, individuals on the program haven't been required to undergo redeterminations to see if they still qualify for services. Their coverage has just continued throughout the time frame, unless individuals moved out of state, died, or requested that their coverage be terminated. This means that some of the most vulnerable populations, such as children, pregnant women, and postpartum mothers in the state of Arkansas, have been able to receive life-saving medical care for the past 2 years without coverage interruption. At the beginning of the new year, the public health emergency is expected to be declared over, and redeterminations of coverage are expected to resume. My name is Cassandra Glover, and I'm the Health Policy Analyst for Arkansas Advocates for Children and Families. Medicaid, the lived experience, has afforded me the opportunity to engage with Arkansans throughout the state and hear about their personal testimonies regarding the Arkansas Medicaid program.
I'm Laura Kellums. I'm the Northwest Arkansas Director of Arkansas Advocates for Children and Families. Our organization works to change public policy in ways that can provide children and families the opportunities and the resources they need to thrive in Arkansas, to live full and productive lives, and to be healthy. And one way we do that is to ensure that our state's Medicaid policies work well for the families that the program serves.
And some of the benefits that Medicaid has done for me is I've had some surgery like back in April, and I needed some tumors removed. Thank God they were not benign. So it went where I didn't have those funds. Medicaid really stepped in to save my life.
Arkansas Advocates for Children and Families participated in a national initiative aimed to amplify the lived experiences of those within the Medicaid population throughout 34 states in the nation. AACF was a part of a cohort of child health policy and advocacy organizations coordinated by the Georgetown Center for Children and Families. Their goal was to learn more about the strengths of the Medicaid program and opportunities for improvement. They also aim to lift up health inequities caused by structural racism and persistent poverty impacting Black, Indigenous, and people of color. AACF worked with our community partners to seek out stories from Medicaid applicants, enrollees, and community providers. We focused on obtaining stories from historically excluded populations, specifically the Marshallese community, the African American Black community throughout the central, delta, and southern areas of the state, and the Hispanic Latino community, where higher rates of health disparities persist. AACF collected a total of 171 Medicaid stories, and throughout each one, we were able to understand the importance of access to health care services. Arkansans expressed their gratitude for the Medicaid program because it provided them the opportunity to manage their conditions and attain life-saving treatment. Arkansans were also able to suggest what would be helpful to ensure comprehensive care for their families. Arkansas Advocates for Children and Families has been a dynamic and effective voice for Arkansas children and families. We are guided by a vision calling for equity for all children. Some of our organizational policy priorities are health, education, child welfare, tax and budget, economic security, early childhood, hunger, immigrant children and families, and equity. I'm starting my journey to visit the different communities to collect the lived experiences of families in Arkansas.
Nonprofit that helps homeless LGBTQ young adults is finding a new home itself. A historic property on 7th Street is being renovated for Lucy's Place.
Lucy's Place is a grassroots nonprofit that provides LGBTQ+ young adults experiencing homelessness in Arkansas housing solutions and additional resources.
How has it been navigating the Arkansas healthcare system, Medicaid system?
Well, I'll be nice to you next month. It's hard because my mom had always took care of everything for me. And then when I turned 18, having to do everything myself, I really didn't know what to do. I was lost. Which in a way, I kind of wish she wouldn't have sheltered me, but I understood why. But I feel like my mom could have better prepared me for the future because she had to know I eventually would very, very off on my own. She had to know. But it's hard, but it's also, I have some people to talk to about it. They do try to help me, just it's difficult doing all this stuff myself. Medicaid means a lot to me because without Medicaid, I have nothing. No medication, nothing that I need. No way to doctor's appointments. Like I've been a lot of debt for the things that are essential to my everyday life. So far, going to the eye care doctor and going to the primary care doctor, and they all three have helped. Yes, Medicaid is helping definitely.
It's been difficult navigating it, you know, like my diabetes is kind of like out of control because of it, because they don't want to cover everything, like the medicines and stuff. Like sometimes not having all the medicines I'm supposed to take, it causes me to have complications.
So Medicaid impacted my life when I first got coverage when I aged out of my family's plan. I was 25, and at the time I was working in restaurants. I was doing like a lot of retail, hospitality, industry type work, and so I didn't have coverage through my employer. I was just waiting tables, and my biggest concern at that time was keeping my birth control covered, and so I was able to get that at no cost. But at the same time, I was also having a lot of issues with my mental health and suspecting that I was seeking a diagnosis for bipolar 2 actually at the time, and finding a good therapist for me and seeking prescription to help me with that as well was a struggle, because I know that there are a lot of mental health practitioners that are covered in Medicaid, but finding one who is Black, trans, and queer competent, who's able to meet me where I'm at without really being a big financial strain was the hardest part. And I still haven't been able to find one, really, to this day.
The Marshallese community is getting hit hard with the current health crisis. In Washington and Benton County alone, a high number of COVID-19 deaths from this group have been reported. KNWA's Lauren Craycall explains the struggles the Marshallese are facing and what message they want to get out to the public.
If we really are going to take care of all Arkansans, as we say we are, that includes the Marshallese community as well.
Next, I'm headed to Northwest Arkansas to visit the Arkansas Coalition of the Marshallese. They are a nonprofit organization whose goal is to empower the Marshallese community through culturally sensitive programs, including policy advocacy.
If AACOM wasn't in the community, that would be a huge negative impact, because a lot of our people need these services and resources that AACOM provides. With my kids having Medicaid, it's a positive, because my son, when he first received Medicaid, or our kids, he was able to see a therapist and receive those types of services for children who have autism. Medical insurance is really important because in the Marshallese community, we are riddled with so many health problems. And I think medical insurance helps us go see the doctor, pay our bills, and get those medications that we really desperately need to be life or death. If my kids didn't have Medicaid or even any health insurance, we won't know what kind of health issues they have in the future I think the bills would be it would be too high for us to pay. A lot of our medical issues that are really common in the Marshallese community is diabetes, TB, tuberculosis, cancer. Another one is prostate cancer. And right now, with all of us not knowing the nuclear history of the United States, you know, them testing those 67 bombs, nuclear bombs on our islands and experimenting on so many families. It's kind of, it all relates to our health issues. And ever since them bombing our resources, our food has been, a lot of our food that are imported or exported is from processed food. So that's where our diabetes issues come from or stem from. And then a lot of our cancer issues, our health issues come from the nuclear testing or radiation. And with the reinstatement of Medicaid in 2021, that was very, it really helped, because a lot of our families, they died during the pandemic, and a lot of our elders, they didn't have insurance. And just seeing them suffer without any help, that broke me. But then when Medicaid was reinstated, I saw that there was hope. And a lot of them came to us to apply for Medicaid. And we saw that there was a light. I mean, there's still issues, but now we see them going to the doctors and they're happy when their Medicaid is approved, or they can go and they say, oh, you know, while it's pending, just go see the doctor. And that makes me happy when they come back to my office and they say, you know, I got approved and my bills are being taken care of.
Ever since the Supreme Court ruled that states do not have to expand Medicaid as part of the Affordable Care Act, there have been big battles over that issue. One bipartisan alternative has emerged in Arkansas that appeals to some other red states as well, most recently Virginia. It allows Medicaid dollars to be used to buy private insurance for low-income residents. But now the Arkansas program is facing a crucial vote in the state Senate this week, and its fate may be jeopardized.
Next, we're headed to DeQueen, Arkansas. We'll be meeting with Dr. Floyd Gonzalez, who is a pediatrician that serves primarily the Latino and Hispanic community.
Are we ready?
Yeah, we're all set. Okay.
Roll it.
So, Dr. Gonzalez, where is your clinic located?
It's in DeQueen, Arkansas. It's about 6,000 people. About 65% are Hispanics, mainly from Mexico, some from Central America, Salvador, Honduras. And they're not used to have the medical care that we provide here in the United States. So it's a high impact, you know, and takes a lot of education that if the kid gets sick, they need to come to see the doctor. Most of them, the kid gets sick and they go to the pharmacy, pick something over the counter, and sometimes by the time they get to me, they are in very bad shape. The census of the clinic went down low because people were scared, you know. Social media, politicians exploiting the COVID epidemic, pandemic. So many kids stay home. They didn't come to see me. I would say the clinic dropped dropped about 40–50% in the census. Medicaid has a lot of gimmicks, you know? For instance, they automatically stop the service when the kid becomes 1 year of age. And remember, this is people that most of them, they don't know any English. So by the time they know that they have to come back for the 15 months immunizations, oh my God, I don't have Medicaid. The kid should have, that qualifies for Medicaid, should have Medicaid, period.
In a KRK4 News update for you, the developmentally disabled waiting list became a bit of a topic during the special session as part of the debate against making income tax cuts. But the governor said they've been aware of the issue for a while now. KRK4's Jay Burr telling us what the governor announced in regards to his list today at the briefing. Hey, Jay, what do you have to say?
Well, Bob, Arkansas's Medicaid waiver actually provides those services to the developmentally disabled here in Arkansas. In fact, the waivers cover about 5,000 Arkansans, but there is a waiting list in the thousands to receive those services here in the state. In fact, it's just over 3,200 that are on that list, to be exact. Now, over half on the list have incomes low enough to qualify them for some Medicaid services, but the rest are getting no types of services.
Next, we are heading to Dermott, Arkansas, to visit the Tabernacle Baptist Church. One of their ministries is providing a food pantry for families in need throughout the Delta region.
My role as pastor, I've been pastoring here going on 27 years. 27 years will be the first Sunday in June. It just entails of a lot of ministries. I believe the church should serve the people. I don't care if it's food, clothing, prison. And that's our model. When Jesus said, go into the prisons, and when I was there, did you come see about me? And when I was hungry, did you feed me? So we try to do all that. And so that's how the food came to play. Being a church, you just got to be involved in ministry. I guess would be like 500 families a month, around about 100, a little over 100 a week. So that's how many it's a lot of hungry people. And we just don't serve Chico County, we serve DSHA as well, Drew. Whoever want a box of food, we accommodate them. A lot of times people don't know what we can offer. I'm connected with a lot of different entities. Certified religious assistant, I teach a program onto the prison. And last year, I worked with legislators to get over 65,000 Arkansans record sealed because there's a lot of people that need jobs, and when they come out of prison, they used to give them like what I call prison jobs and may not pay much, and they end up going back into the system because they're not making enough income. So we try to tap them into resources to help them find a skill if they hadn't found one inside the prison. So when they get out of prison, and they can have a good skill that they can make a good income, not just a job, but a skill certification. Healthcare, it's a really plighted area, especially Chico County, and a lot of people need health care. They can't afford sometimes health care. Some have 3 or 4 children that they're barely making it, and what we want to try to do is try to make sure we find out that they get proper health care, and so there's a need for health care in this area badly. Medicaid is important because it carries the load when they can't afford it. It can kind of help assist in getting what they need and getting the proper health care they need. We try to help them get connected with better health care. If they need the record seal, if they need clothing, we offer a lot of things here at the church. We connect you with the resources or the entities that can help the people in the community so they can sustain themselves. Giving them a hand up and not really a handout, because sometimes that's what all a person needs. And so we try to make sure that happens for this community, and it's been working. We need grocery stores badly here in the city. A lot of small towns are struggling with that. Then we need more, I guess, facilities that, like for instance, I got sleep apnea. And you have to go so far to, and it wasn't for VA, I don't know what I would do. Probably have to drive a couple hours to Little Rock or Monroe. But having clinics in our area that can meet the health needs for people with sleep apnea or any other disabilities that a person may have, that they don't have to drive so far, because transportation can be an issue here in the area.
Because I have Crohn's, I go to the doctor often, probably twice a month, sometimes more.
And what about for your babies?
For my kids, it just depends on if they're sick or not. It impacts my life in a lot of ways, meaning I don't really go out as much. I'm not really as social as I used to be when I was not sick. I've been dealing with it for like 13 years. I've had about 16 surgeries. So I'm managing it, it's okay. I have good days, I have bad days. Not that I don't appreciate the government, but in 5 years, I hope to be off of government assistance to be able to support my kids and my household.
Medicaid have impacted my life because when I first moved here in 2008, I had 4 teeth that were bad, no insurance. Now with Medicaid, I was able to get my teeth pulled, and also the medicines. I don't pay anything by having medicines. So it's good to have coverage because I can go to the dentist, the eye doctor, I can go to any doctor, any specialist. It won't cost me a dime. So it's wonderful. I have diabetes. I have sepsis in my leg, which is a blood disease. I have high blood pressure. I have COPD, and I have bronchitis. And without Medicaid, I'd probably be dead or half dead. With Medicaid, I can get a full supply of oxygen, I can get all my medications, and with my leg being bad, I also have a hospital bed through Medicaid. Without my oxygen machine, I can't breathe at night, so I need it. With being a diabetic and this bad blood disease in my leg, it would be awful. I don't think I would be able to maintain because that medicine is high. Like my diabetic medicine is like $3.90 for a vial, and that's really expensive. And also, like if I had, can I say anything about Medicare? Okay, if I had Medicare, I couldn't get the hospital bed, and I would have to pay a copay every month on the oxygen, which costs like $3,000 a month to run. Okay, I can go to any specialist, and I can get 9 medications where it used to be 6. I can get that free. And with Medicare, I would have to pay like each bottle would be like $12 or $15 or $30. So I'm grateful for having Medicaid.
Having access to doctors and hospitals is crucial, especially if you're pregnant. But tonight, several parts of Arkansas do not. Thank you for joining us at 5. I'm Faith Woodard.
And I'm Rolly Hoyt. A new report from the March of Dimes says almost half of Arkansas is now considered a maternity care desert. As THV 11's Brooke Buckner takes us a closer look at this problem and what different groups are doing to try and fix it.
47% of the counties in Arkansas are part of those deserts, but another 21% have low access or moderate access.
Dr. Chriselle Nash with Arkansas Blue Cross Blue Shield says the decrease in maternity care access is a problem, and there's several factors behind it. A county is considered a desert if it doesn't have a birthing center or birthing hospital, and if there aren't any OBGYNs or certified nurse midwives.
Ujima Maternity Network is a nonprofit organization established to address the Black maternal and infant health crisis in the state of Arkansas.
So Ujima provides lots of services, and at the end of the day, the objective of Ujima is to really service Black mothers and families to not only survive but thrive during their pregnancies, postpartums, and the childbearing years. The way we do that simply is through our monthly maternal community outreaches. And so women can come through and get doula support, and it's free of charge. They can get free of charge doula support and education. They can get lactation support. They can also see Black apprentice midwives as providers to kind of round out their care and create a more holistic experience and more relatable, where they can let their hair down and don't have to think so hard or feel like I have to explain some things, right? There's just a little bit of an unspoken understanding that happens when your provider, you feel like you can relate more to your provider.
What was the catalyst for developing Ujima?
Oh, that's an excellent question. Does anybody want to go? Because I'm fired
We needed services to provide for people that look like us. We needed a space where women felt comfortable. We needed a space where women felt safe.
Black mothers are suffering, and they're suffering for many reasons, and it's multifaceted, right? Multi-layered, but representation matters. And so Black women weren't seeing themselves receiving this type of care, and they weren't seeing themselves like receiving it or providing it. So Ujima came up because we just needed that. We needed greater representation, and we needed women to know we're here and we exist for you.
Some of the issues that I see in Arkansas for mothers in general, lack of provider access, I would say. I had clients not even 6 months ago, they were doula clients, and they hadn't even had an OB appointment at 20 weeks because the provider that they were seeing was full. That's an issue, that's a problem. When you can't even get in a timely manner to see your OB provider. I know that with clients that we see for home births, we like to start care as soon as possible. I think now it is normal for an OB provider to start seeing clients around 10 to 12 weeks. They're waiting way longer than that now to see OB providers because they don't have space. Everything is there's not enough providers.
And just to add a little bit to that, Arkansas is, the word I'm looking for, it's a desert, right?
It's a maternity desert.
It's a maternity desert. So women are having to travel great distances to get to places that have OB hospitals, right?
Most everybody has to come to Little Rock,
right?
Conway, Pine Bluff, Fayetteville. Those are the Fayetteville area, that Northwest Arkansas, and Jonesboro. Those are the main areas that you can receive OB care. If you live outside of those areas, you're traveling in to get care.
Yeah, so a healthcare desert, an OB healthcare desert, that's one of the other issues. And so women aren't getting the lack of access, right? So they're not getting care because they don't have access to it. And everything so far, just imagine you don't have childcare. And, when the pandemic hit, that was also another thing where you had to come and you had to be by yourself. But what if you're a single mom with 2 other children and you can't get in?
I had that happen with one of our clients. It was the doula client. She was a client I had through the project that we worked on last winter. In the middle of that storm that came through with the ice and snow and all that, single woman, no children, no vehicle. And she was in Southeast Arkansas. So the push and my encouragement for her was call 911 so they can come get you. Well, they wouldn't come get her because she lived too far out and it wasn't an emergency. She wasn't feeling very well. So ultimately she got in her car that she borrowed from a neighbor and drove herself 2 hours to the hospital where they told her to go back home. She ended up spending the night in the waiting room at a hospital because they wouldn't see her.
One of Ujima's initiatives and heart is really to go into the rural areas and develop and train up women that live in those communities already to provide quality care. So raising up doulas, raising up midwives in those areas that can service women and really kind of be the community person. That's a far off project. That's a big project, but that is something that is available that we are seeking to build, and how Ujima is seeking to be a part of the solution to the problem. Because I feel like we can list problems all day long. I mean, we could just go problem. But until we start looking at what are the solutions, we can identify the problem, and then from there we need to start identifying solutions. And then what are tangible solutions? So truth be told, we can't necessarily attack or infiltrate like the medical system, but what can we do? So on the grassroots level, we can, with our skill sets, raise up other women, train them up in areas where there is a lack of healthcare, lack of resource, so they can be the community person. I mean, just imagine like kind of how it was, right? Like you walk down the street to like Laquita's house and you're gonna go help her have her baby or listen, help her with her blood pressure or whatever, things
or
like
even
that.
just the education component of it, doing childbirth classes for those communities so they know, teaching them when it's time to step up and advocate for yourself.
Right.
Even with the providers that they have, if they have providers in those areas. Because a lot of times too, we see women that are just kind of going along with the okie doke and we're like, you need an advanced level of care, or you need to start asking more questions about this because that's not normal.
Right.
So even just getting into those lacking communities and giving them the education about their bodies, about their, even down to like teaching them about their cycles and how like babies happen, because some people just don't know. They're just out there going willy-nilly. Those are all things that can be helpful in communities to help prevent tragedies, and then also just getting them more comfortable with advocating for themselves so that they can have better care.
Well, advocation, let's speak on that too, because just our presence, in my opinion, I might be biased, but in my opinion, just our presence here gives women the voice to say, hey, I'm gonna write my representatives, I'm gonna write my congressman, I'm gonna make sure that they're hearing my voices so these changes can be made. Because us alone, we can't make those changes. Like the consumer needs to be making those changes. They need to say, hey, I'm not okay with this. I'm not okay with these services. I'm not okay with how this medical field is going. Let's make these changes, and these are the changes I want to see being made. The time you spend with your client, you get to know them. It's not a job. Like, you become friends, you become family. So you know when things are happening. So if something turns and goes the wrong way, you're the first person to see it. And so you can say something to their doctor and say, hey, something's wrong. Did you do something, or did you give them something, or did you, is something wrong? And if they see it, then they're on top of it because they're busy doing other things. They're repairing tears and other things. So you're the first eye. So positive for me is you can see something going downhill before they do. Also, like, families love you. Like, you're not the...
They hate you until they love you.
They hate you until they love you.
They don't understand.
Right. So, like, you're not making things happen. Like, they're doing the job. You're just there supporting. But they're so happy that you're there to support them. And they tell you, like, they're just so happy. Like, I couldn't have done this without you. You could have. You absolutely could have. But I would love to be here to support you to do that, So, yeah, that's my take on it.
Yeah. I think there's so again, multi-layered. All of this is just multi-layered, multifaceted, right? So positives for me is just that moment when a woman and a husband even feels like we did that, right? And we were supported to do that. Like, somebody linked arms with us. We were heard. Our voice was heard. My concerns were valued. And then we brought forth our child. Some of the challenges that I've seen with my clients with Medicaid in Arkansas is backlog paperwork. So women that are pregnant, looking for services, looking for support, and not being able to get them until further down the road in their pregnancy. And so they're lacking care because they don't have any coverage to see their provider. And so that creates a lot of delays in things that could be caught.
And financial hardship though, because a lot of times, even if they do want that, let's say they're 12 weeks pregnant and their provider takes Medicaid and they're waiting for that backlog approval or whatever, that doctor wants money to see them beforehand. So then they do wait because they don't have it. They're on Medicaid. They can't necessarily afford to pay out of pocket. But if they are, they're paying $1,000, $500, $1,000 per visit until that Medicaid kicks in, and then they have to deal with reimbursement from the doctor's office once the Medicaid. It's a mess. It's a mess.
We just had one.
Yes.
With her blood pressure was just constantly spiking, and we were like, you need to go to the hospital. She went to the hospital. They sent her home
3 times.
3 times, and then they were like, follow up with with an OB. She chose midwifery care. She had a midwife for home birth, but then the care needed to be elevated to an OB provider. She was still within her 6-week postpartum window, but they wouldn't see her. So, I mean, what do you do with that? Like, those are holes in our system, and women are falling smooth through those cracks, and they're not getting the help that they need. And then they're like, well, why? If you're going somewhere and you're like, this is supposed to help me, this is supposed to be solutions, and then it turns out that it's not a solution, then you're going to just stop going. Then you're going to tell your friend not to go. And you're going to create a lot of
distrust
and like a homeopathic whatever that may or may not be good for you.
There's a lot of mistrust right now.
Yeah.
It's a lot of mistrust.
Well, for my clients first, they have some coverage. There is something there. If they need coverage for dental, medical, pregnancy, whatever, there is something there versus having to come out of pocket to pay for things. For me personally, one of the positive things when I moved to the state of Arkansas, that's all I had because I wasn't employed at the moment. I was a student in nursing school just trying to make my way, and like I had a kid, I had a whole child that needed to go to the dentist, that needed to go to the doctor to get checkups and all those things, and she was vaccinated, so she needed vaccines and she needed all the things. So that was a positive thing for me personally, to have that to fall back on when I was in transition, coming from one state to another state, being able to provide that or being able to have that resource to provide for my child.
I was kind of similar with Sarita for myself. I was finishing up college. I didn't have a job, and so, but I had this baby, that needed vaccinations. If he got hurt, I needed to take him to be seen. It was just there. I had it, and he could be seen and be taken care of. So
I agree. I think there's a lot of relief in the idea of if my child, specifically for the child, I think sometimes we need to focus maybe a little bit more on that, or we do as parents, right? There is a relief to know I can take my child to be seen in an emergency or just for regular routine care to make sure my baby's growing or everything is healthy with my child. There is some relief in knowing I don't have to come out of pocket to do that. So Medicaid has definitely filled some holes when it comes to that, and people being able to have the confidence and support to like get care.
In 2022, the Arkansas Department of Human Services started the Medicaid Client Voice Council. This council consists of Medicaid beneficiaries, and its purpose is to gain insight on what is working and not working for Arkansans throughout the state who receive Medicaid benefits. The hope is to create sustainable, systemic, and policy changes that will better serve families throughout the years to come. I currently serve as a member on the Medicaid Client Voice Council, and today marks our last meeting for 2022.
Yeah, so part of my job as Deputy Director is to administer, kind of oversee the Medicaid Client Voice Council, help put together the agendas, helped with the recruitment and selection of members, helped get the speakers lined up based on the topics that the council members want to hear about or what they want to present to the council. And so and then doing the newsletter every other month to the council members and to the DHS offices. So the former Secretary Cindy Gillespie of DHS, it was her idea to start the council. She believed that DHS heard from providers, she believed that DHS heard from lawmakers, but she wanted to make it easier for DHS to hear from the clients, the people we serve. DHS is a huge behemoth of an organization. I mean, we're the largest employer in state government. And so to make significant change takes time. We have had some policy initiatives. For example, one of our members is disabled, he's wheelchair bound, and when he would go in the hospital, Medicaid is paying for his hospital stay. It didn't want to also pay for his caregiver to come along with him. It would be like double billing. But his point was, nurses aren't in there with me 24/7. If I drop my phone, you know, I can't be buzzing the nurse 30 times a day to come help me pick up my phone because I can't do it. And so they put in a request for, with the federal government, a request for a caregiver to follow a patient into a hospital when it is a real need, and it is a real need in his case. So that's just one small example of how the voice of the council has been able to impact policy at large in Arkansas. There are other examples, but you know, we told the council members when they started, this is like turning a big ship. It doesn't happen on a dime. You have to, you know, go with the process, submit your ideas, and let's see where it goes. So they know, I think the council members know that, and their expectations are realistic, that they're not going to, you know, change the world in one meeting. But over time, I think the council has a real opportunity to impact DHS programs for the betterment of the people we serve.
If I was to lose Medicaid, it would be hard if I didn't have a little bit of help from other sources. And I really just don't know how I would survive because I do have to see a doctor quite a bit. And I am on 15 different prescription medications. So, I mean, it would dramatically impact me, and then I would most likely end up having seizures again constantly.
Healthcare coverage is important to me and my family because I have an infant, and without it, in today's society, I don't know what I would do.
When I was getting prenatal care, I really did have a successful birth due to Medicaid services being available for me as a new coming mom.
It's been very helpful for me. I'm type 1 diabetic. Insurance is paid for my insulin pump. I was hospitalized in June. I was in a coma for 2 weeks. And I lost my hearing. I got an infection in my eyes because my sugar ran high. And I got yeast in my blood and it got on my heart, caused a heart infection. Just went and picked my hearing aids up the other day. I lost my hearing when I was in a coma. But for the most part, it's helped me. Let me see. That's basically it. I mean, it pays for my, I don't have any co-pays with Blue Cross Blue Shield.
You just heard stories that address the strengths and some of the main concerns families in Arkansas with Medicaid have faced. Arkansas Advocates for Children and Families state policy priorities include extending Medicaid postpartum care to 12 months and allowing pregnant women to begin immediate prenatal care via temporary application while their full Medicaid application is being processed. Covering children on Arkansas Kids A for 12 months without dropping off or having to reapply to restart their coverage. This can ensure eligible families to keep coverage during the Medicaid reevaluations for all households when the public health emergency is over. For 45 years, Arkansas Advocates for Children and Families has served as a voice for children at the Arkansas State Capitol and in Washington, D.C., to ensure that all children and families have the resources and opportunities to lead healthy and productive lives.